How to perform urine analysis and pregnancy test. For a urine analysis test, you need to gather supplies. You will need hand wash supplies, gloves, urine dipsticks, urine sample, and paper towels. You start by washing your hands and don gloves. You obtain the urine sample and confirm the patient's details, name, date of birth, and hospital number if applicable. You're going to take a visual inspection of the urine. Straw or hay-colored urine is considered normal. Dark concentrated urine denotes dehydration. Red or pink urine can signify hematuria, and brown urine occurs when bile pigments are present. When performing a visual inspection, you should also inspect the clarity of the urine. Clear is normal, and cloudy is containing debris, which is a common sign of a UTI. If it's frothy, the patient can be suffering from nephrotic syndrome. Next, obtain the urine dipsticks and check the expiration date. Remove one test strip from the container. Place test strip into the urine, ensuring all zones on the test strip are immersed, and only dip the strip long enough to saturate all zones. Remove the strip and lay horizontally on a paper towel, allowing the excess to blot onto the paper towel. It is important to ensure that the test strip is placed in a horizontal orientation to avoid cross-contamination of zones. Finally, interpret the test results by holding the strip next to the coordinating color zones on the test strip bottle. Ensure that you are reading each zone after the time specified under each test. After reviewing results, document findings and discard the urine test strip. Recap the urine sample and dispose of urine in the toilet. Then dispose of urine sample in the biohazardous waste bin. After disposal, remove gloves and perform hand hygiene. For a pregnancy test, you will need hand wash supplies, gloves, pregnancy test, urine sample cup, towelettes, paper towels, and a dropper. You will then need to instruct the patient on how to obtain a clean catch urine sample. You will first verify the patient's details by obtaining a patient name and a date of birth with the details on your chart. Next, verify the label on the urine sample cup that it matches the patient's information. When testing the urine sample, perform hand hygiene, don gloves, place the sample cup on a clean paper towel, obtain the pregnancy test, and check for the expiration date. Inspect the package to ensure that it has not been compromised. Open the pregnancy test and place on a level surface. Using a dropper, obtain a small amount of the specimen and place the required amount of urine per test instructions, usually 3 drops, onto the reagent spot. The specimen will migrate along the window using capillary action. Set a timer with the time specified by the test manufacturer to ensure accurate results. If the test is left standing for too little or too long, the results cannot be interpreted accurately. The control line is an indicator of sufficient urine volume. If you do not see the control line, then the test results will be invalid. Read the test results by comparing indicator to manufacturer's specified symbols. Discard paper towel, test, and gloves into the appropriate waste receptacle. Perform hand hygiene and document test results in the patient's chart.